One of the programs that's getting a lot of traction in our symposium this year is our science prerequisites for health professions. We mentioned yesterday the volume of students in that program, and really it's one of our innovative products that's gotten a lot of traction. Your computer went to sleep. It's gotten a lot of traction over the years that it's existed. So I'm very excited to welcome to the stage our panel from Instructional Design, who's actually going to talk a little bit more in depth about that product itself. So please welcome our Instructional Design team to talk about the role of IDS in health science course development.
Thank you. Well, hello everyone. We're delighted to be here today to talk about our roles in the development of online health science courses. My name is Olga LaPlante, and with me today are Chris Malmberg and David Bass-Clark. Chris and I are instructional designers, and David is an educational technologist. Wendy DeBrigida worked with us as well to create this presentation, but she graciously allows us to take all the spotlight today. So one question we hear often: what are instructional designers? What is our role? And let's see what people think about it.
I think my best guess for what an instructional designer does is, the first thing that I thought of was that they come up with curricula for people. It's probably totally off, but that was the first thing that came to mind.
Someone who designs like instructions for like different products and stuff, I guess.
Okay, so my best guess for what instructional design is something that is visually designed to show someone how to do something. For instance, a how-to video.
I think an instructional designer works really hard designing instructions on classes they design.
All right. So what do instructional designers do? Instructional designers have expertise in adult learning, course design, project management, and instructional technology. We apply that expertise to facilitate effective teaching and learning. We do this by collaborating with academic programs, faculty, and subject matter experts to create high-quality, rigorous courses. At UNE Online, we have a team of 7 instructional designers and 1 educational technologist. We support 6 online graduate programs, approximately 140 courses, and 2,100 students, plus 17 science prerequisite courses for health professions. The science prerequisites for health professions courses, also known as SPHP, will be the focus of this talk. SPHP offers students a fully online option to complete science prerequisites needed for a graduate health profession application or medical school application. These students are non-matriculated. Most are enrolled at other universities, and typically they need 1 to 2 courses. SPHP courses are self-paced, asynchronous, and are designed to be completed in 16 weeks. Average completion time is between 10 to 14 weeks. All courses are facilitated by remote faculty members and are open for enrollment on a rolling basis over 3 terms. This means that newly enrolled students have 2 opportunities per month to start a course. The current enrollment is approximately 4,500 students. So our goal here today is to take you through our process of developing online health science courses. We'll be sharing some specific examples from 2 recent SPHP course developments, Pathophysiology and Medical Physiology. We'll present some of the design challenges in creating fully online and self-paced courses, especially for non-matriculated students. We'll also provide examples of instructional strategies for active learning in an online environment. And we'll end our presentation with a look at how the latest research and tools can inform innovation in our development process. We hope that you'll leave this session with a better understanding of how our courses come into being and see the benefits of working with an instructional designer. Here's an overview of our SPHP course development process. Instructional designers collaborate with academic programs, faculty, and subject matter experts to design effective courses. In SPHP course development, we typically work with subject matter experts who are medical professionals but do not teach, or who teach only face-to-face classes, or who teach online but not in a self-paced format. It usually takes 32 weeks, start to finish, to develop a 16-week course. This time frame includes everything from the kickoff meeting with the instructional designer, subject matter expert, and the academic program, through designing the course plan, developing assessments, content, multimedia, building the course and the learning management system, quality assurance checks, and ends with the course launch. And now I'll let Chris Malmberg take over from here.
The process of course development is defined by the necessity that they function, the courses function, as legitimate analogs to the face-to-face courses that are trying to teach the same thing. Essentially, our pathophysiology course must be as good as any face-to-face pathophysiology course. The challenge is that our patho course functions online, so the learning activities we design have to function, be accessible, and be authentic in that context. This is difficult for a couple of reasons. Without a larger program in which the pathophysiology course may be considered a modular piece, because SPHP is non-matriculated, to define what it needs to cover, we need to be able to tell from its learning outcomes alone that we are doing the subject of pathophysiology justice. Additionally, we have to make sure the activities and assessments we build into the course are actually meeting those outcomes. Authenticity is difficult to measure, so we work backwards from what we know students must learn or do to what we have to teach. Olga will be covering backwards design in a minute, and I don't want to hog her spotlight. In our SPHP courses, we pause directly following the first step of backwards design, where we and the SME work together to distill and define the course's likely learning outcomes, and then turn those outcomes over to a committee of experts. Are these really the outcomes we need? Only after we've incorporated the committee's feedback and gotten their okay, and this is largely driven by the program itself, do we move on with the process of backwards design. And like I said, here to talk more explicitly about backwards design, I'm going to hand it back to Olga.
All right, so let's dive into actual course design process. Online instruction often requires more prep work and front-loading than most face-to-face courses. So while the course development improvement process is in place for continual improvement for the course, the ultimate goal is to have the course in its best possible shape before the first student logs in. We start with the end in mind. We design our courses using backward design, which means that in the beginning, we identify the final learning outcomes, the behaviors and skills the students will have mastered and are able to demonstrate once the course is completed. The curriculum requirements and overall course and program outcomes are determined by the faculty, SME, and administration of the program. The instructional designer's role is then to ensure the best formulation of those learning objectives. Well-stated learning objectives are measurable and student-centered. So instructional designers provide feedback and work with the SMEs to articulate learning objectives. Next step is determining adequate and appropriate assessments and necessary activities to prepare students to demonstrate their performance. So designing learning activities presents yet another challenge. Since the courses are self-paced, students enter the course at different times, stay with the course for various periods of times, and progress at a different pace. What are some strategies for addressing the challenges of the self-paced course? On the one hand, it is as if every student has a unique path to course completion. Learning activities are designed in such a way that they are indeed responsive to a certain degree to each individual's pace and learning goals. The trick is to find a way to provide feedback on student learning wherever students are in the course, as well as offer some choices in topics and formats. In our courses, we include test yourself quizzes, which provide immediate feedback and can be taken multiple times, and chapter tests, so students can get a sense of their performance before they take exams. Discussions or papers may include a choice of articles to select from. Students would read and evaluate them or relate the concepts to their learning. Another example is a final project that may be a presentation on one of several topics that are united by one theme. To maintain a certain structure, activities are often sequenced using adaptive release or conditional release. That is, students are required to complete a certain task or earn a certain score before another item or assignment becomes available to them. However, certain parts of the course can be completed together, and so students have some flexibility in what activities they and related assessments they complete within a certain time frame. Finally, study guides. They are provided to serve as a summary of topics and concepts that a student should expect to address during a midterm, a final, or a unit exam. All major exams are proctored and are often set up to allow only one attempt. Thus, in addition to study guides, which help students organize their learning in preparation for the course, we set up practice exams. So these help students try out the look and feel of the actual exam as the way it functions in Blackboard. Practice exams are timed, but unlike the actual exam, students may take them several times. Another challenge of self-paced is peer-to-peer interactions. We strongly believe that learning is social, and student-to-student interactions can create a better learning experience. Thus, discussion forums and live classrooms, that is, live sessions with instructors, have been introduced to engage in peer-to-peer communication. These are somewhat similar to office hours. They use an online conference tool like Blackboard Collaborate or GoToWebinar or Google Hangouts, and are highly interactive. Since the self-paced courses are asynchronous, and these live sessions are synchronous, they are not required and are available to students as recordings afterwards. However, their primary goal and value is in live interactions with instructors and other students. Another opportunity for peer interactions is discussions. For self-paced courses, this is a fairly recent addition. Students are required to participate and often are supposed to address a prompt in a certain module. Remember that all of the students can be different places in the course, so the discussion is not tied to a module, to a week or a schedule. It's tied to topic or unit of study. Typically, students are expected to submit their response before they see other people's posts and are expected to comment on their peers' threads. Time is an illusion. Lunchtime doubly so, suggested Douglas Adams in The Hitchhiker's Guide to the Galaxy. And needless to say, time management is universal, and distance education appears to be a universal problem. Doubly so for students who don't have a set course schedule. Our courses last 16 weeks. Many students expect to complete them in a shorter period of time, but they sometimes don't start until quite several weeks have gone by. So while the self-paced aspect is attractive to students, a calendar of some sort is a tool they would benefit from. The promise of self-paced has to be delivered. Other than the course end dates, there are no due dates in the course itself, and there are no deadlines. However, we include suggestions as to course schedule. For instance, our modules or units are labeled weeks, and so that students can conceivably create their own schedule, their own calendar using this. And an additional challenge of distance learning in health sciences is the lack of lab facilities. Our solution to this is a partnership with science lab kit companies who put together custom kits with the sorts of experiments we need for a specific course. The kit becomes a required course material that students must purchase. At this time, the lab lessons are not integrated with our current LMS, and ideally they would be part of the course. While we are working on the integration piece, our students have to go to the third-party website to complete their labs. In addition to the standard experiments, our subject matter experts have designed their own, modifying and building on the existing assignments. Unfortunately, but quite understandably, the at-home lab experiments are still quite limited. We have thus integrated third-party virtual interactive labs into our courses. Students perform virtual lab experiments and complete lab reports or answer questions based on their findings in a way that approximates the real-life lab experience. So this is an overview of our strategies for addressing the design challenges, and now Chris will walk you through several examples from our courses of the activities and products that we have implemented.
As we're ensuring a tight course alignment so that we know that student learning will be authentic, we and the program are always thinking about what students will find engaging. This is probably the most obvious challenge for online course design. How do students and teachers get and stay excited for the course subject matter? How can we simulate an authentic experience in a virtual environment? Do we have to simulate it, or is the real thing also an option? In some cases, we do have to simulate, but our simulations are getting better. Shown is one of the lab simulations we use, developed by Pearson to test students on substances that are too dangerous or costly for them to experiment with on their own. Here's another example. These solutions are smart enough to allow for accurate recreations of real reactions that would occur in a real lab with real hydrochloric acid, minus the burns. The students follow directions for conducting experiments and record their observations. Is it a real lab? No, but it is very scalable and very safe. But we don't have to rely on the virtual all the time. This is a sheep's heart provided by Hands-On Labs along with their dissection protocol that is sent out to students in our Pathophysiology course. In that same course, students also receive a cow eye, a sheep's brain, and a sheep's kidney. For each, they follow annotated pictorial directions and cut into the organs, take images, upload, and annotate the parts online. They also answer questions about what they see, identifying, extrapolating, etc. Early on in the development of pathophysiology, the program and IDS identified a recurring problem among the students in that class. Many needed to be better grounded in anatomy, probably because it had been a while since they had taken an anatomy course. So we decided to try integrating a little bit of anatomy. Actually, I think this mostly came from the SME, but it was a good idea, into the patho course with engaging activities to refresh their memories. These dissections were a big part of that push, and they've been working very well. Also from our pathophysiology course, we've integrated some 6 or so comic-based case studies. Here's a piece of one. I'll read some of it. I'll read all of it. Hello, Mr. Napier. How do you feel? What brought you in today? Morning, Doc. I'm here because my stomach hurts. When did the pain start? It started about a week ago after taking some prednisone. The prednisone was for my asthma. Did you take the prednisone after eating as prescribed? No, I was in a bit of a rush. I think all I had was coffee that morning. How do you feel when you eat? And it's blocked off here, but he says it hurts a lot more when he eats. Do you still smoke and drink alcohol? I'm smoking less, and I only drink alcohol on weekends. Actually, last weekend I could not drink because of the pain. How's your stool? Have you noticed any change in color? No, it looks normal. Okay, sounds like we need to perform a pen endoscopy and order some blood tests. These are very effective because we can take slides from a microscope or an X-ray or a point of view image of an infected wound and place them into the panels. We didn't pick one of those for this, for obvious reasons. This puts those pieces of information into greater, really essential context of the patient's story and the doctor's experience of that patient's story. A case study like this is followed by a quiz in pathophysiology, but it could be integrated into wide varieties of assessments. For instance, we could ask students why the doctor decides that a pen endoscopy is the right course of action. We could then construct a rubric that grades students on how capable they are at evaluating the patient's story and medical history. Does the student correctly isolate what is important given the patient's complaints? Can the student elaborate on why those particular details are important? I'll leave you with one final example of an assessment in pathophysiology. This SME, it should be said, Roberto was super gung-ho about trying a lot of cool stuff. Video presentations. We found that asking students to present the concepts we've asked for them to learn is a very valuable motivator to learning them in the first place. And so video presentations are widely used in UNE courses in general. The details and requirements of the presentations are often designed to simulate real challenges, such as presenting technical information to laypersons or communicating essential information succinctly to a technical audience. Sometimes these presentations are even designed to be synchronous. In all cases, we try to keep tabs on what seems to be working and why. There are more flashy tools out there than there are legitimate reasons to use them. So even as we talk about engaging our students more, our primary goal is always to help them learn. And here to talk more about that is David.
Just really quickly this is unplanned, sorry. But if you've taken a medical physiology or anatomy course of any kind, either online or offline, or taught it, raise your hand. Okay, keep it up. If you were an instructor, put your hand down. If you were a student, keep your hand up. If you took it offline, put your hand down. So this should only be people that have taken it online before. Okay, just wanted to get an idea of the audience. We aren't finished yet. There's a continual development cycle in which we redesign our courses based on student faculty feedback and as well as developments in technology and evidence-based practices. I'm an educational technologist, as Chris and Olga indicated, and after the development cycle we just talked about briefly, I work with our team of instructional designers to help reimagine and redesign our courses. Our mission statement emphasizes innovation, and we see that redesign process as an opportunity for research-based innovation and to maintain the high standards that our students have come to expect from UNE Online. Many of our pre-health courses, oops, I didn't go through the rest of those slides, but that's okay. Give me some examples here. Many of our pre-health courses require students to memorize a large amount of information in a relatively short amount of time. So here are some examples of how the latest research and tools can inform innovation in our redesign process. So research shows that there's a correlation between the improvement in student assessment scores and the use of a memory technique called the method of loci or memory palaces. So we're going to talk a little bit about that. That's from an endocrinology class, that research. We're also going to briefly touch on virtual reality and 3D space, and then interactive narratives. So the Greeks and the Romans actually developed the memory palace technique over 2,000 years ago. Again, it's also called the method of loci. When the use of traditional memory aids wasn't very effective for particularly challenging vocabulary, this is really good for medical terminology, anatomy, physiology. Students can create an image or a series of images in their heads to help them act as memory triggers. So the stranger the funnier it is. Let's give an example here, a specific one. Macula. I did not know what this meant, but here's what it means. The light-sensitive layer of tissue lining the interior of the back of the eye. Fairly dry stuff here, but we need to figure out how we're going to make it a little bit more engaging. So what if we imagined the Mac part being a Big Mac and the Cula part being Dracula? So what if we put those things together and we had the macula? So we have two things going on. We have those two images in our mind that kind of trigger us to remember, but they also have something to do with the actual physiology. So we have the light-sensitive receptors there and neurons firing down. So we have a couple of different image triggers that we can get from that one image. To create a memory palace, you actually put each of those images into a familiar 3D space. So it could be your house, like in this picture is a floor plan of a house. It could be your old school. One example from a student that actually uses this is a medical school student. He says, let's say I'm using my high school swimming pool as my palace for the lung pathology chapter. I reach a section about interstitial pneumonia. I might choose to put that in the men's locker room and have that as my exclusive area for all of the images that we see up there used for interstitial pneumonia. So that's kind of the basic idea. You put them into a 3D space. Another thing that I mentioned here is that we can leverage virtual reality. This is something I'm particularly interested in myself. This is a screenshot of a program called Unity. And Unity is a program that leverages the creation of 3D environments like we saw there. And we can work with the subject matter experts to create a memory palace for the students. So we could actually create one that makes sense to us and give it to them to wander around and see different images, right? But we could also go a step further than that by allowing them to create their own. And this is actually already happening in offline programs, and we're trying to figure out how we can pull this into an online program. So this is from the University of Toronto, and this is a video atlas that students are helping to manipulate or create in 3 dimensions. So that's kind of way in the future, but we're trying to figure out how we can make more engaging experiences like that. We're also very fortunate to have the clinical simulation lab located right here in our office building. And this affords us the opportunity to create interactive narratives based on scenarios such as the bumbling lab partner, in which your partner forgets all of the medical terminology that you're supposed to know, and you have to quite literally remind them interactively and fill in the blanks. So again, this places this into a narrative and makes it a little bit stronger for that recall. Using an authoring tool like Articulate Storyline, we would then be able to capture that student data and put it into a formative or summative assessment within our learning management system. Cooperation with the Simulation Lab is a really good example of how we can innovate using existing resources. So as we wrap up our presentation, we hope that you've gained a deeper understanding of the role of instructional designers. And we want to thank you for your time and open up the floor to questions if there are any, if we have any time.
You showed the image in the simulation lab, and were you using that as a hypothetical example or an example from a course that is already making use of that collaboration?
The 3 examples that I gave were all examples that we would like to do that we're thinking of, but they're not examples that we've done yet. So this is kind of the future of where we'd like to see it go. Good question. Great, thanks so much.
Thank you.